First, check the scenario. Always ensure the safety of the emergency scene by looking for hazards that could be dangerous for you as a rescuer, the victim and the bystanders as well. You don't want to end up as a victim as well. After ensuring the security of the emergency scene, check the cause of injury or illness, and the number of victims present within the vicinity. In order to determine for responsiveness, tap both shoulders of the victim, and ask loudly, "Hey hey, are you okay?" As soon as you check the victim, and if there is a need, make sure to ask someone at the scene to call the hospital. Look for at least 2 persons to ask, and make sure that you pinpoint the person by calling their name or description to avoid confusion. Kneel by the side of the victim and proceed with the simple A, B, C and D procedure. Do the head tilt, chin lift maneuver. Place one hand, palm down on the victim's forehead, and gently apply firm pressure to tilt the head backward. At the same time, place the index and middle finger of your other hand under the bony part of the lower jaw near the chin, and raise it. Check if there are any blockages in the mouth or airways. Do the finger sweep method by wrapping your index and middle fingers in a clean cloth and sweeping the inside of the mouth for liquid and foreign object that can be seen. You must also check for serious or profuse bleeding by observing and looking over the victim's entire body, from head to foot, for any signs of cuts or other injuries with blood. Stop to examine the victim's breathing by looking for the rise and fall of their chest. Bend down and listen for sounds of air movement coming from the victim by placing your ear next to the victim's mouth and nose. Assess the circulation by feeling for the carotid pulse. To find this pulse, use your index and middle fingers. Locate the Adam's apple and gently slide your fingers to the side nearest you. Feel the air passing in and out by placing your cheek next to the victim's mouth and nose as well. After assessing for bleeding, check the victim's skin condition. If there is decreased circulation or slow pulse, the skin becomes cool and pale or cyanotic. Lastly, make sure to establish manual inline stabilization by bringing the victim's head into a neutral inline position. Ask someone in the scene to hold the victim's head so that the nose is in line with the navel and the neck is not bent forward or backward. The person holding the victim's head must maintain this position all throughout the procedure. Lastly, apply a rigid cervical collar to help stabilize the victim's neck. Treat all unconscious victims as if they have spine injuries until proven otherwise.
Splinting is the technique to secure the part of the body that is injured to decrease further damage and to make the individual comfortable until treatment can be initiated. A splint is a device used for support or immobilization of assumed fractures. Splints may be improvised from items such as boards, poles, sticks, or whatever is available. To avoid further discomfort, you can put padding at the end of the wood with a piece of cloth or bandage.
You must seek the appropriate size of splints that will be used in the victim. The splint should be long enough to immobilize the entire bone plus the joints above and below the fracture areas. Splint the injury in the position you found it. Immobilize the entire injured extremity, plus the joints above and below the fractured sites. Secure the splints with the bandages starting from the distal ends, farthest from the center of the splint to the proximal end, closest to the center. When slipping the bandages under the extremity of the lying victim, place the bandages over a separate splint and gently slide the splint under the extremity. You must avoid any movement or lifting of the fractured side. Make sure to splint firmly enough to immobilize, but not too tightly to stop blood circulation, or even prevent lung expansion. In securing the chest area with bandages, ask the victim to inhale deeply. If the victim is unconscious, use 3-finger breaths, index, middle and the ring, as allowance for lung expansion. Hold it along the sternum before applying the bandages.